while we've been at this for almost 2 years, we're still in the thick of things.
This pandemic winter is shaping up to be different from the last, where hospitals were nearly overwhelmed. Since then, cases and hospitalization rates have fallen, thanks in large part to 75% of county residents, some 2.3 million people getting vaccinated.
Which is higher than the state, which is higher than the nation. And actually for Southern California, we are the leader.
County Public Health Officer Dr. Wilma Wooten and Health and Human Services Director Nick Mascione have been leading pandemic efforts here.
I think the biggest gift you can give someone this holiday season coming up, if you love someone, you care about them, is get vaccinated.
There have been upticks in COVID-19 cases and hospitalizations since Thanksgiving, and officials are asking people to celebrate responsibly this holiday season.
If people continue to be careful about their actions, their behavior, we can get through the winter months as well. But the anticipation of cases going up over the winter months is a significant concern.
This winter, there's no large vaccination superstations, and recently the focus has been on delivering COVID boosters and shots for younger kids.
Access is not a problem. What is the primary issue is those people that are not vaccinated making the decision to become vaccinated.
The pandemic revealed disparities in the way people have access to resources and health care. The state identified zip codes in underserved areas that needed extra attention.
We've just maintained that approach. And in fact, not just for COVID. This is the work that's informing in what we're doing even more broadly, be it for homeless, be it for mental health, be it for housing, be it for children and families in need.
With the help of a new board of supervisors, the county has been investing millions in homeless resources. At existing shelters, staff provide mental health services, public health nurses, and work to connect people to assistance programs. Now officials are looking to open their own shelter in the East County and some in partnership with other cities.
It's about sanitation. It's about providing people with the elements of daily living that we all expect and actually deserve.
Health officials say the drug crisis is almost equally a pandemic. They report that 1 in 13 San Diegans have a substance abuse disorder and say more resources are desperately needed.
We have built the most wonderful hospitals and clinics and then maybe public health, right? We're catching up on infrastructure. But alcohol and drug treatment has not been, it's always been stigmatized as well, and has not been an area that has been invested in.
County staff are working to overhaul the existing behavioral health system. Mascione says mental health, addiction, even homelessness can be interconnected and should be treated that way.
How do you build truly a behavioral health continuum of care? That is the tentacles that touch not only the homeless, not only the opiate fentanyl pandemic, but also the rising number of mental health challenges we've been seeing, right? And so that is being led by our behavioral health services. It is a massive undertaking. It's not just bricks and mortars and assessment centers.
Another focus for health officials are aging San Diegans.
We're not going to be quite the new Miami or Florida, but let me give you an idea. You know, in 2010, we had about 600,000+ San Diegans 60 and older. By 2030, it'll be pushing about 850,000. That's a significant increase. That's one of the fastest growing age groups.
The county wants to make sure they are prepared, and that means more investments in elderly care. And some good news for prevention efforts. After historically being underfunded, public health departments should be getting a boost from the next state budget.
Don't know how much that will be, but that's what we're hearing will happen, and I think that it will go a long way in helping to shore up the infrastructure.
Wooten says a priority will be updating IT systems to make sure public health efforts are as efficient as possible. Matt Hoffman, KPBS News.